Hello guys, welcome back, and today we are going to discuss about another nursing diagnosis and care plan. And today we are going to see about anxiety. So here you can see a nursing diagnosis for anxiety. Anxiety related to stress and trauma as evidenced by reported evidence of nervousness and fear in patients' activity. Or you can write anxiety related to stress as evidenced by reported evidence of nervousness. Or you can write anxiety related to trauma as evidenced by reported evidences of fear in patient's activity. Okay, so this is the nursing diagnosis, and now we are going to see the nursing care plan for this condition. So, as I said, when you write the nursing care plan, you have to add these all what columns? Okay, assessment, diagnosis, planning, rational, implementation, and evaluation. Okay, so under assessment, what you have to write? Both subjective data and objective data. Under subjective data, write what the patient is saying about the condition. That is, the patient says that he is feeling nervousness and unable to verbalize the feeling. Okay, in objective data, you have to write what is your observation as a nurse. So here I have written like the patient looks dull and tired. And in diagnosis column, you can write the same thing. That means diagnosis, anxiety related to stress and trauma as evidenced by reported evidence of feeling nervousness and fear. Then goal. What is the goal? The patient will be able to acknowledge and discuss about fears and concerns. So that is your goal. Okay. So goal and diagnosis you have to write in the same column. Then you can go for planning. Okay. So in the planning column, you have to write the planning in one by one, then rational implementation. Okay. So whenever you write a nursing care plan, start your nursing care plan with history collection and physical examination and mental status examination if it is related to mental health problem. Okay, so you just write do history collection and mental status examination for what? To understand the general condition of the patient. And in implementation, always you have to write in past tense. Okay, so completed or done or finished physical examination and mental status examination. Then second, assess and acknowledge the presence of anxiety. So for what? To get an awareness about the patient's feeling of anxiety. Then assess and acknowledge the presence of anxiety. Then assess vital signs. Patient's vital signs will be abnormal if they're feeling anxiety. So in implementation, what you will write? Assess the vital signs and there is a slight variation in blood pressure recorded and inform the physician. So whatever you have done that you can write in implementation column. Then assess the degree of anxiety. So here what you should know means you should know the types of anxiety, either it is mild, moderate or severe. Okay, so to understand the level to provide proper support. So if you understand that the type of anxiety, you can give proper care to the patient. Assess the level of anxiety and the patient is experiencing moderate anxiety. Then assess the patient's ability to concentrate and speak. Sometimes if they are anxious, sometimes they can't concentrate and speak properly. So you have to understand that to avoid the consequences of severe anxiety. Okay. Then in implementation, you can assess the patient's ability and started interacting with the patient. All right. Then next planning is provide active listening to the problem. That is very, very important that you have to add at any cost or listen the patient, okay, to improve the level of comfort of the patient. So in planning, you can write provided active listening and the patient started to talk and listen the ears. Then instruct the patient about relaxation techniques. You can use any relaxation technique depending upon the condition of the patient to reduce the level of anxiety and release of endorphin. Endorphin is a hormone which helps to relieve anxiety. Then instructed the patient about relaxation technique like music and what's deep breathing exercise. So it depends upon your patient. So here I have given listening music and do deep breathing exercises. Then educate the patient about coping mechanism for what to improve the mental health of the patient. So patient started to follow a regular sleep and eating pattern. So that is the coping mechanism that I have started to give for my patient. Then identify the resource of the patient to can use to relieve anxiety. Any resources that depend upon the condition for what to reduce the level of anxiety. Identify the resources. So here I have identified meeting family and loved one to communicate is the resource which helps the patient to relieve his or her anxiety. And encourage the patient to do positive self-talk for what to improve the self-esteem and confidence. So encourage the patient to do self-talk. So past tense, encouraged. Then provide medication for what? To reduce the severity of condition, and provided medication as per the doctor's order. That you have to specifically mention as per the physician order or psychiatrist order or doctor's order. Then you can go to evaluation column. Then evaluation column, you can write the patient demonstrated an ability to discuss and started to talk about his or her concern. So patients demonstrated. Okay, so they're also past tense. So you have implemented it, then that is the evaluation. Okay, so this is about nursing care plan for anxiety. Hope you understand, guys. Thank you.